Welcome to this explainer. If you rely on daily medication to fight off an infection, you probably have a standard everyday routine, right? You pop the pill, wash it down with whatever is handy, and just go about your day. But what if your morning drink of choice is actually secretly neutralizing your antibiotic before it even has a chance to reach your bloodstream?
So can a simple glass of milk really ruin your medicine? Did you, by any chance, just wash down your morning antibiotic with a cold glass of milk or maybe some calcium-fortified orange juice? Okay, let's dive into this. Because if you did, your body might not actually be getting the medicine it needs. We're talking specifically about ciprofloxacin here. It's a powerful fluoroquinolone antibiotic, and it is incredibly effective against everything from urinary tract infections to severe respiratory illnesses. But here is the catch. Its effectiveness depends entirely on its journey through your digestive tract, and this specific drug is extremely sensitive to what else happens to be hanging out in your stomach.
Now check out the molecular structure of ciprofloxacin, specifically those reactive chemical groups right over there on the right side. In the highly acidic environment of your gut, these functional groups act a lot like microscopic magnets. They are highly reactive, essentially just waiting around to coordinate with other molecules. So what's the problem? Well, when these little chemical magnets encounter positively charged ions, like the ones hiding in your breakfast, they lock on tight, and they literally do not let go.
And that brings us to a process called chelation. When those microscopic magnets on the ciprofloxacin molecule bump into heavy calcium ions from your milk, yogurt, or cheese, the calcium effectively handcuffs the drug. It forms what's known as an insoluble chelate complex. The absolute critical issue here for you as a patient is that this brand new drug calcium complex is physically way too large and chemically too awkward to pass through your intestinal walls. Your gut simply cannot absorb it. So instead of entering your bloodstream to actually go fight your infection, the antibiotic passes straight through your digestive tract and gets excreted. Research actually shows this single interaction can drop the absorption of ciprofloxacin by 30 to 40%, and honestly, sometimes even more. Plus, to make matters worse, a milk protein called casein also acts like a physical trap, absorbing the antibiotic right onto its surface.
Now you might be sitting there thinking, oh no, do I have to give up dairy entirely while I'm taking this antibiotic? Well, the short answer is no, but context is literally everything here. What's really interesting about this is that manufacturers and clinical guidelines draw a really sharp distinction between having dairy all by itself versus having it as part of a larger mixed meal. If you take your ciprofloxacin pill and chase it with a glass of milk or a bowl of yogurt by itself, you are creating the absolute perfect storm for chelation. You're basically dropping the antibiotic directly into a pool of calcium and casein, maximizing that chemical binding we just talked about. However, if you take it as part of a full, mixed meal that just happens to contain some dairy, the non-dairy proteins, fats, and fibers actually create a physical buffer. They provide competing binding sites and slow the whole chemical reaction down, which means a much larger portion of the free drug survives and gets absorbed into your system effectively.
So, how do we actually navigate this scheduling in our daily lives without going crazy? Well, here is the golden rule to safely separate your medication from calcium products. If you are taking ciprofloxacin, you need to take it at least 2 hours before you consume any dairy. This gives the drug a crucial 2-hour head start to dissolve and fully absorb into your bloodstream before the calcium ever even hits your stomach. On the flip side, let's say you've just eaten a bowl of yogurt or drank a glass of milk. In that case, you need to wait a full 6 hours after consuming the dairy before taking your next dose of the antibiotic. This ensures your gastrointestinal tract is entirely clear of those sneaky binding agents. Timing is absolutely everything here. It can literally be the difference between a cured infection and a completely failed treatment.
All right, while we are on the topic of how to take this medication safely, we really must pivot for a moment to a very serious authoritative warning that comes with ciprofloxacin. Now, this doesn't have anything to do with dairy, but it is absolutely crucial for any patient taking this daily medication to understand. Ciprofloxacin carries an FDA-boxed warning for the risk of severe tendinitis and tendon rupture. In fact, this entire fluoroquinolone class of antibiotics has been associated with disabling and potentially irreversible serious adverse reactions affecting the tendons. This most frequently involves the Achilles tendon right at the back of your ankle, but it's also been reported in the shoulder, the hand, the thumb, and even the biceps. Your tendons are those incredibly tough cords of tissue connecting your muscles to your bones, and this medication can actually cause them to become dangerously inflamed, or in severe cases, to completely snap or pop.
60. That is the critical number you need to remember here. Patients over 60 years of age are at a significantly higher risk for developing these severe tendon disorders. This risk also shoots way up if you are currently taking corticosteroid drugs or if you've ever had a kidney, heart, or lung transplant. But please keep in mind, tendon ruptures can actually happen to anyone taking this drug, even if you don't have those specific risk factors. They can occur within hours of starting the drug, or incredibly, even up to several months after you've completely finished the therapy. If you're taking ciprofloxacin and you experience any pain, swelling, bruising, or inflammation in a tendon area, or especially if you hear a snap or a pop, you must stop taking the medication immediately and call your doctor. Seriously, do not exercise, do not put any weight on it. Contact your healthcare provider at the very first sign of pain.
It is pretty incredible how much is going on behind the scenes when we just swallow a simple pill, isn't it? I mean, between the microscopic chemical magnets chelating with the calcium from our breakfast, to the physical barriers created by milk proteins, and then those very serious biological warnings we have to watch out for with our tendons, it's a whole lot to manage. It really makes you wonder, what other hidden food drug battles are happening in your gut right now? Every single time you mix a medication with your daily diet, an invisible chemistry experiment takes place right inside you. I really hope this explainer empowers you to take charge of your health. Always check your pharmacy labels for unexpected dietary interactions. Remember to separate your dairy when needed, and respect the incredible complex chemistry that keeps you healthy. Thanks so much for joining me for this explainer, and keep asking those great questions.